Hi beautiful people, hello everyone, welcome back to my channel. Still your favorite nurse god. So today we are going to be talking about constipation and diarrhea under community setting. Yes, I did video under hospital setting for management of diarrhea and constipation under hospital. So I'm doing this video now because of people that is asking me some questions related to community setting. So I'm going to do this video specifically for management of diarrhea and constipation for community setting. All right. Okay, so this video is going to be of help to professional nurses practicing in the community setting, and also those that are preparing for their NMC UK OSCE examination, and also the nurses still in the school, that's student nurses or midwives, yes, that are preparing to write their final examination or promotional examination in the school. This video is for you. But before we proceed to what we have today, please still remember to subscribe to my channel, comment, like, and share. God chicks love you all. So guys, let's dive into what we have today. Constipation under community setting. All right, now let's say that Mr. John, our nursing problem number one is Mr. John is experiencing constipation. Okay, or Mr. John is having constipation. All right, then our nursing aim is Mr. John will show less signs of constipation after nursing intervention. All right, and then nursing a reevaluation day. Please pay very attention on this. It's one of the difference that is under the other one. Okay, nursing re-evaluation day is Mr. John will be re-evaluated today after 30 minutes of nursing intervention and as clinical condition changes, because you are going to be with that person 30 minutes. You are there in the person's house because it's under community setting. Mr. John will be re-evaluated today after 30 minutes of nursing intervention and as clinical condition changes. Remember, under today, say 10/2/2024, depending on your day, after 30 minutes of nursing intervention and as clinical condition changes. All right, under E matter read, number one is E. Explain all aspects of nursing care to John and gain consent for all the nursing intervention. Next is monitor John's vital observation and escalate according to NIS2 policy. Next, assess John's stool using Bristol stool charts. Okay, then after you have assessed John's stool using Bristol stool charts, next is encourage John to take copious fluid intake to prevent constipation. Next, encourage John to take more of fruits and vegetable and fiber food to reduce constipation. Next is to collect the John's stool sample and send to the lab for diagnosis to find out the cause of the constipation, which can be medication such as morphine. All right, and then the next is encourage John to involve in activities of daily living to reduce constipation. All right, and then the next is identify the need for frequent assessments. Okay, next point is to liaise with the doctor to prescribe laxative for Mr. John to reduce constipation. And next point is teach Mr. John the indication and side effects of his do prescribed medication. Next point is administer do prescribed medication to Mr. John and assess its effectiveness after 30 minutes of administration. All right, and then the next point after you assess administration of that medication is to encourage John to call 999 or 111 if there is any concern. Please listen. encourage John, this is one of the difference, encourage John to call emergency number such as 999 or 111 if there is any concern. Okay? And then next point is ensure proper documentation of nursing care rendered to John with date, time, and signature. And that is it. All right? And then next one we are going to manage now is diarrhea under community setting. All right. So under diarrhea, we are going to say in two nursing problem is Mr. John is experiencing diarrhea. M is Mr. John will show less signs of diarrhea after nursing intervention. Okay. Mr. John will show less signs of diarrhea after nursing intervention. Re-evaluation day, remember, very important. To be re-evaluated today after 30 minutes and as clinical condition changes. To be re-evaluated today after 30 minutes and as clinical condition changes. All right, and then we move over to demand planning, which is E matter read. Under E, explain all aspects of nursing care to John and gain consent for all the nursing intervention. 2 is monitor John's vital observation and escalate according to NIS 2 policy. Monitor John's vital observation and escalate according to NIS 2 policy. Okay, and then next is to collect stool sample from John and send to the lab to find out the cause of the diarrhea, which can be infection such as norovirus and also Clostridium difficile. Okay, and it can as well be food poisoning. All right, okay, and then next point is after you must have identified the cause of it, you now liaise with the doctor to prescribe anti-motility medication for Mr. John to reduce diarrhea. Next is to administer that due prescribed medication to Mr. John and monitor its effectiveness after 30 minutes of administration. Administer due prescribed medication to Mr. John and monitor its effectiveness after 30 minutes of administration. All right, and then the next one is to encourage John to call emergency number such as 999 or 111 if there is any concern. All right, and the next point is to identify the need for continuous assessments. Okay, and the last is documentation. Ensure proper documentation of all the nursing care rendered to John with date, time, and sign. Finish. Stephanie, yeah, we are done. That is it. Okay, you can see it's very simple, and that is why I say that nurses are beautiful, nurses are brilliant. You can do it. Believe in yourself. You can do more than you think. All right, the power is in you. Okay, so guys, thank you so much for watching my video. Still remember to subscribe, guys. Subscribe to my channel. Share this video to beautiful nurses out there. Okay, comment, like, and share. Love you guys. Thank you so much for watching my video. I appreciate it. Bye bye.